Yes. Jaldi se we'll do a quick revision of the last session. What to expect? We spoke about the science behind cases which we should advise for bleaching and the other bleaching techniques. So we discussed a very basic regarding bleaching, what exactly it does and what is the main function. The procedure is basically involves lightening of the color of the tooth. तो ब्लीचिंग में हम टूथ वाइटनिंग कर रहे हैं, उसमें बेसिकली फंडा हो क्या रहा है, जो टूथ discolored है और the tooth which is pigmented, the organic components of the tooth which are pigmented are lightened up through the application of a chemical agent which is a strong oxidizing agent, that is carbamide peroxide and hydrogen peroxide which we use are a very strong oxidizing agent which oxidizes the organic pigments and results in lightening of the tooth. Okay. So cases which you should not select for bleaching, first of all, is very important. Other cases which are highly sensitive, extensively restored, teeth with hypoplastic marks which have deep cracks and defective restorations. And commonly used components, carbamide peroxide, very often used in home bleaching, available in concentrations from 5 to 20%, and home bleaching usually 35% solution, or I'll say 25 to 35% of solution of hydrogen peroxide. Okay. So these are the common solutions which are available. We also have sodium perborate and superoxole, especially for the non-vital bleaching or intracorneal bleaching, which we'll be discussing. Now, what is the mechanism of action? It's very simple. Hydrogen peroxide breaks into water and nascent oxidants and other free radicals like perhydroxyl and other free radicals which acts on the organic pigments which are present on the enamel or dentine and resulting in lightening of their pigments. Sodium perborate, which I mentioned for the non-vital bleach or intracorneal bleach, are also available. We spoke about the other components of bleaching agents, that is carbopol. Basically, carbopol is a thickening agent which helps the active ingredient, that is S2O2 and carbamide peroxide, to stay in a viscous state, and it stays on the tooth for a longer duration, and slowly and gradually the dissociative components, that are the perhydroxyl ions, the nascent oxygen, slowly and gradually diffuses into the enamel and shows the effectiveness, that is acts on the organic pigments and slowly and gradually it lightens up. So we need a good, I'll say, stability of the solution which we are using, that is carbamide peroxide or hydrogen peroxide, which should stay on the tooth, and there should be a slow diffusion into the enamel. So the whole function is performed by carbopol. Other components are the urea, surfactant, preservative, vehicle clearing. We spoke regarding the function of surfactant, which is for wetting, preservative, long duration, long life, vehicle, mainly glycerin, and flavoring agent for pleasant taste. Science behind bleaching was very important. It was told that high molecular weight complexes, basically जो tooth में discoloration होता है वो high molecular weight organic molecules होते हैं enamel या dentine में, which are reflected as stain. Okay, so basically when an oxidizing agent acts on it, and जो oxidation के by products होते हैं free radicals के, वो इनको low molecular weight में convert कर देते हैं, जो कि less complex होते हैं, and when the light is placed on it, the reflection of light is I'll say less pigmented or less discolored, or the lightening of the tooth occurs. अगर पूरा detail में chemistry जाएंगे तो, for example, if you are using hydrogen peroxide, it oxidizes or diffuses and dissociates into hydroxyl ions, perhydroxyl radicals, perhydroxyl anions, superoxide anions, and they attack the organic pigments, which results in I'll say acts on these inorganic pigments to lighten up. This is the basic funda. Or the reflection of light is such a way, when the pigments are lightened, they appear more brighter. That is, the teeth appears more brighter. So this was a simple funda behind this. This science or chemistry is important because whenever we select the case, we should be aware that if the enamel is discolored or superficial dentine is discolored, or any defect is there, if there is spitting is there, or patient has an extensive restoration, the main funda is acting on the organic pigments which are present on the tooth. We can't select all the cases. We can't select the cases where the pulp chambers are very high, or the dentine is exposed, or where it is has a large restoration, or there is extensive discoloration. Okay, so when you understand the science how it acts, you are better able to decide. Okay, yeah. So these were the main components, but we should also focus on through how the procedures are done. Basically, several light sources have been advised when we go for a laser treatment. That is, the bleaching kit inherently has bleaching components, but when we assist with a photochemical reaction, that is through a light source, lasers, or other components, it is said that the free radical formation or the hydroxyl ion formation is a little faster, and so the bleaching or the effect or the results are achieved in a faster way. This is the thought process when the different light sources or laser assisted bleaching is used. But I'll be also discussing several studies which has disproven this effect. Okay, so effect on the tooth hypersensitivity, very common. So a lot of bleaching kits have given sodium fluoride, or they add calcium phosphate. They have shown to reduce sensitivity. Effect on enamel. So when we do bleaching, studies have shown there have been mixed results. Okay, some studies have shown there has been decrease in enamel height, hardness or demineralization, and also they have shown that when we put a fluoride application, or if we wait for a week or two, there is replacement of the mineral content which has been lost, and remineralization occurs. So there may be a demineralization or loss of hardness on the enamel, but if we wait for 2 weeks, or I'll say at least 10 days, yeah, the minerals which have been lost will be replenished. Okay, effect in dentine pulp cementum, yeah, few sensitivity, and specifically in terms of non-vital bleaching, that is intracoronal bleaching, cases of cervical resorption and external root resorption have been reported. Effect of composites, yeah, it was very important. Now the two criteria are there: either their tooth has a composite restoration and you're doing a bleaching. Okay, first criteria. In that, the effect on the composite itself won't be much. Okay, the effect would be more on the bonding. That is, the bonding may be a little compromised, and the color of the composite itself may not change, but the staining which composite has acquired may lighten up. Okay. Mucosal irritation, yes, very well. Burns with bleaching on the gingival lips have been uh, shown in patients where the gingival barrier or lip protection is not done. And in the last session, Dr. Akash Anand, I think Dr. Anand asked me a question regarding what we can do if accidental bleaching agent falls on the gums or lips. Yeah. So that time I told we could apply a coating of Vaseline earlier, and then we can put few gels and all, because it will take its own uh, time of 7 to 21 days to have revitalization to occur. But commonly we can use vitamin E oil. Okay, so we can buy vitamin E capsules and puncture them and apply on the burn areas, or we can keep it. So it has a good results and faster recovery. So to Dr. Anand, we can use vitamin E oil. It works wonderful. A lot of articles have shown that they have used vitamin E oils in case of burns through bleaching on the gums or lips. Okay. The remedy is simple. Effect on bonding potential of composite. Now it's a second criteria, that when we have to bond on composite. That is, after bleaching, when you have to do a composite. For example, a very simple case or technical case I'll tell you. For example, you have done one of the central incisor, you have done bleaching, and after bleaching, what has happened? The color has been almost similar to the adjacent tooth, or you want to make exactly similar, you do a veneer. That is either with direct composite or indirect veneer with porcelain laminate veneers. But now you have to remember that we can't do the preparation or bonding immediately after the bleaching. You should wait at least for 10 days, or some people say 2 weeks also. Why? Because we just now discussed regarding the effect on the effect on the enamel in terms of its reduction in hardness and demineralization. So we want the replacement of the minerals which have been occurred after bleaching, so that when we do bonding, we get good bond strength. So to have a good bond strength, we should perform a composite or any bonded restoration at least 10 days to 2 weeks after bleaching. So we spoke about home bleach, that is night guard bleach. It's a simple technique in which we use 5 to 20% of carbamide peroxide, which is equivalent to roughly 3 to 6.5% of hydrogen peroxide. And we use in low concentration because in home bleach, we the patient tends to wear or have a contact time with the bleaching agent is much higher. For example, if he is doing a day bleaching, it will be 3 to 4 hours. If he is doing a night bleaching, it will be 6 to 8 hours. So we just have to provide a good fitting customized tray in which he can put the bleaching agent, and then he has to wear it. Okay. So there was an indication: smile staining, tobacco stains, color changes due to pulpal trauma, avoidance in severe fluorosis or severe stain case, and especially opaque white spots cases. Okay. So one thing I would like to add in opaque white spot cases, that in patients which have opaque white spots, okay, if you do bleaching in these patients, there is a tendency that opaque white spots will be more prominent. So in these patients, you can wait for a week after bleaching so that it can replenish. The color would be more matching rather than more exaggerated in terms of opaque white stains. Or what I'll do, go for micro abrasion or a layering. That's it. Fabrication of tray, you use a 0.035 on an average. Standard size is this. You can also use a thicker 0.05 also. One thing which I would like to add, if you are planning for a home bleach and planning to make a customized tray, just trim the model on which the bleaching tray has to be formed in the cervical area. Okay. So what will happen when the the heat pressed tray is formed? When you have trimmed in the cervical area, the tray will lock. So excess flow into the gums and all would be minimal. So this was the extra added things. So as I mentioned, if he's wearing in the day 3 to 4 hours, in the night it will be 6 to 8 hours. So obviously in the day, if the wearing is less, so we can increase the concentration from 15 to 20%. If in the night the wearing is less, you can reduce the concentration from 5 to 10%. So the results will be achieved within 1 to 3 weeks in cases of, I'll say, night. If the patient is wearing in the day, if he is wearing in the night, it may take 2 to 3 weeks. Simple, 2 to 4 weeks, I'll say. So I'll say in Western countries, the bleaching with the home bleach is very much into fashion, and regularly patients go for a home bleach every 2 years, I say. So now, as I have felt in India, most commonly we do in-office bleach, or we focus on office bleach, which is the main, I'd say, the main part of this today's session is the office bleach. So in this office bleach, we use a concentration of hydrogen peroxide of 25 to 40%. Okay, high concentration hydrogen peroxide will be using. This is the main bleaching agent. Now we know the chemistry. When we apply on the tooth, it dissociates or oxidizes into I'll say S2 and nascent oxygen, and followed by free radical formation into per hydroxyl ions, which act on enamel to lighten the pigmented organic molecules which are present on the stains. This is the funda. So now in home bleaching, all the control was on the patient's hand. That is, the duration he wears, the results would be according to that. Now in office bleaching, now we have the complete control of the shade also, because we are doing all the procedures on the in the dental chair. So depending upon the duration or the material which you are using or the concentration which you are using, you can do number of cycles or the shade selection which you want. If you want a very bright shade, you can perform a longer duration or multiple sittings. If you want a little change, usually in single sitting also you achieve a good bright result. So now it's a lot of controversial topic ki whether we go for bleaching just by applying the bleaching agent on the tooth. Okay, now we are well aware we just have to apply a rubber dam followed by gingival barrier, or a rubber dam is good enough if you invert the dam, or if you are not inverting the dam or not using rubber dam, you just put a gingival barrier and at least a optra grade or a lip protective something on the lip, so that accidental lip or gum damage doesn't occur with the bleaching agent. Okay, this is the main funda when you start with it. Okay, so now either you can just use the bleaching agent, apply on the tooth, and wait for the mentioned time according to the manufacturer, 15 to 30 minutes. Or now a lot of studies have been placed by using several light sources. Okay, so after you put the bleaching agent, we can also put a light source, maybe a conventional light or a tungsten halogen light, which we used to use for curing composites, the older generation. Yeah, xenon plasma arc, this was also used for curing composite and also used for as a light source in bleaching. Very I'll say in one of the era, the Philips zoom light was very much into the boom for doing faster bleaching. So these are the light source. Also the diode lasers. So diode laser would be more of laser assisted. So now the studies have these light sources were used so that the bleaching action which is occurring, that is dissociation of H2O2 which is occurring into different I'll say oxidizing agent free radicals, would be faster when we use these light sources. So this was the thought process when these light sources were used. Okay, so this was a simple funda. So अपने को क्या करने का है? We just have to apply the bleaching agent, put the light source closer to that area where the bleaching has been done, or the bleaching agent has been applied in the form of gel, and we expect that this light source will do faster bleaching. Okay, and it is thought that if the bleaching is done faster, the contact of this strong H2O2 will be less on the tooth, and chances of post-operative symptoms would be less. This was the thought process. Okay, if I look onto the recent studies from, I'll say 10 to 15 years from now, if we go in the past, lot of studies has been done which have compared different light source bleaching and a normal bleaching without light source. So what are the results which they have found? I'll be sharing with you, so that एक फंडा क्लियर हो जाए कि ये लाइट सोर्स की जरूरत है या नहीं, whether you want to buy a different light source to do effective bleaching, whether it is useful or not, I'll be explaining. Yeah, so this is the tungsten halogen, the commonly used LED light which we used in past. So this was also used as a bleaching light. Xenon plasma arc, both for curing and whitening. This is the zoom light, which after placing the bleaching agent, we have to have a close contact towards the oral cavity, fitting towards the making good seal on the lip, and the light source directly goes on the teeth. Okay. So these were the light source which were used. LED light also some people use. Some people also use the normal light of the chair. But these are the common light source which have been advised or which have been studied thoroughly. But guys, there is a good news that a lot of studies. This is the recent study which was done. But I'll say a lot of studies from 2000 to 2020 have been done, in which bleaching was done without using a light source and with a light source. Okay, there was not much difference in the result of color change and also tooth sensitivity when the studies were done with hydrogen peroxide. So if you don't use a light, so moral of the story is that if you have a light source you can use, okay, but if you don't have a light source also, you can do a normal bleaching by just applying the gel on the tooth. That's it, depending upon the shade which we want or the manufacturer instructions are there, we just need to follow that. Okay. So if we don't use a light source also, the results are same, the tooth sensitivity is almost the same. So this is now clear that if we use or don't use the light source, the result would be a lot more similar. Okay. So no more inventory for buying a expensive light source for providing stronger results. Okay. So now if we go for an in-office bleach, okay, if we go for an in-office bleach, etching of surface to bleach, it is of any use. I watched it in some videos. Etching of the surface to bleach. Yeah. Yeah, Dr. Satish, I just read your message. Etching of the surface to bleach is not needed. Okay. Etching क्या करेगा अगर bleaching करना है हमें, for example, if we are planning to do a bleaching, if we etch the tooth surface, the damage would be more higher because we are creating porosities on the enamel. Demineralization भी हो रहा है, porosities भी हो रहा है, तो नहीं करने का. We just need to clean the tooth. Very important if you want to go for a bleaching process. First step is to do a good finish. I'll say polishing or removing all the plaque debris on the tooth surface, as mentioned on the slide, and followed by you can isolate the tooth. And once you see the tooth is completely clean, all the debris have been removed, then you can put the bleaching agent in, with the help of a, I'll say, gauze or a cotton or applicator tip. एक solution बनाया gel form में, उसको apply करा tooth पे. Now, as we mentioned regarding the carbopol, which is a component thickening agent, that will allow the bleaching agent to stay on the tooth, okay, in the form of gel. It is a thick gel. So we just apply it, and two things we can do: either we can agitate the solution every 4 to 5 minutes, or we can just wipe off the solution and add a new solution on the tooth till the time we want to receive the desired results. Okay, this is the simple funda. So depending upon the manufacturer instruction, for example, if a manufacturer says we have to apply for 5 to 10 minutes, so 4 to 5 minutes we just agitate the solution, or we just replenish the solution every 5 minutes or 10 minutes and put a fresh solution. In the meantime, whenever we'll removing the I'll say etching the peroxide solution on the tooth, when we are applying, and then when we remove, just to replenish the solution, we can check the shade. Okay, so depending upon the desired shade we want, we can apply multiple times. We can apply the bleaching agent on the tooth. Okay, and then very important, as we know, the most common post-operative effect of a bleaching the tooth is hypersensitivity of the tooth. So after removing the bleaching solution, doing good polishing, washing the tooth, very important, washing the tooth. So two things will happen. First of all, the organic pigment which is there on the tooth will get lightened. The tooth will appear brighter. And second thing, there will be a lot of dehydration of the tooth. So after bleaching, wash it thoroughly with water. Okay. When you have washed thoroughly with water, you can just polish it or clean it and then put sodium fluoride gel. This will help in maintaining or reducing the sensitivity on the tooth where the bleaching has been done. So this must be added in your protocol when you're doing in-office bleaching, and instruct the patient not to have coffee, tea at least for 2 weeks, because we know एक तो दांत में थोड़ा रफनेस क्रिएट हो जाता है, हार्डनेस इज रिड्यूस्ड, एंड वी नो डिमिनरलाइजेशन भी होता है, तो chances of tooth getting stained is very high. So at least tell for the 2 weeks. And if you want to go for a permanent restoration, go after 2 weeks or after at least 10 days, and then you can proceed. So it's very simple, following the manufacturer instructions. You do the bleaching solution on the tooth. You can replenish 2 to 3 times depending on the shade which you want. And once the shade which you want is achieved, just wash off it, wash the bleaching agent, polish the tooth, and apply sodium fluoride for a few minutes. Or I told you, if you don't have anything, just keep APF 1.23% APF apply करो, 8 minutes के लिए wash करो. Sensitivity would be very minimal or almost would be negligible. That's it. So this is the basic technique. You apply the gel. If you want to buy a light source or you have a light source, you can apply. But studies have shown the results won't differ if you use or don't use the light source. So you can just do the bleaching without light source also. These were the steps of applying rubber dam. Now I think these techniques are nicely clear enough. If you have doubts, you can ask me so that I can proceed with the second technique in office का second technique. अभी था हमारा normal white tooth पे हमने bleaching करा. अब नॉन वाइटल टूथ आया जिसमें आपने रूट कनाल कर दिया है और वो बहुत ज्यादा डिस्कलर्ड है एडजेसेंट टूथ से. नाउ यू डोंट वांट टू गिव अ क्राउन. You want to go for a conservative treatment. Either you can go with bleaching alone, but what I prefer, go for a thin layering also. For a long lasting result, after doing non-vital bleach, put a thin layer of composite or indirect veneer. So the results would be long lasting. So I'm just waiting for 30 seconds. If any doubts are there in the in-office bleach, I can repeat the procedure or I can add on anything if you have any doubt regarding any bleaching light, the zoom light or other light sources or the technique or the results or the desensitization. Okay, I'm waiting for 30 seconds. I'll be back. So guys, we are back. I think no doubts. Great. So now moving towards the non-vital tooth bleaching. So the component which is used, I told you, we can use sodium perborate and superoxole. Sodium perborate is the commonly used material and the technique is also called walking bleach. ठीक है. तो इसमें the difference is that earlier we were putting the bleaching solution on the labial surface. Now as the tooth is root canal treated, we can have an intimate contact with the discolored part by doing intracoronal bleaching, that is within the tooth. Very simple. So इसमें if the tooth has discoloration, we can just put the bleaching agent, that is sodium perborate, into the I'll say orifice into the coronal part of the pulp chamber where we have to put. I'll be telling you in the techniques. So it's very simple. For example, this is the tooth. After doing an access opening and doing a good obturation, we just remove the obturation material somewhere 2 to 3 millimeters below the CEJ. First step. So when we remove it 2 to 3 millimeters below the CEJ, we can put a good barrier of GIC, IRM, whatever material. GIC is preferred. So we seal the tooth. Okay. Now the sealing is there. That is coronal seal is strong enough. Now we have a lot of space in the coronal part. So we put a fresh solution of sodium perborate into the chamber. Okay. Into the chamber and then remove the excess and place a temporary restorative material. We leave it for a week or two and we waiting for the desired shade which we want to achieve. We can recall the patient after 1 to 2 weeks, and if you feel the desired shade is achieved, you can just wash off the chamber, put a permanent restoration with GIC or composite, whatever is the preference of choice. Okay. So in this, only the difference is there. We use sodium perborate and we place it into the pulp chamber for at least a week or two. till the desired result is achieved. Okay, but it's very important to put a good coronal seal at least for 2 to 3 mm. That's why I told to remove the gatta pacha 2 to 3 mm below the CEJ, because if you don't put a coronal seal, chances of the solution getting leaked and causing cervical resorption. So these are the cases of non-vital bleaching. If you don't put a good seal, there would be a cervical resorption. Okay, so these cases are very difficult to manage. If you're going for I'll say non-vital bleach, always remember to put a good seal to prevent cervical resorption. Though with H2O2 it is more common, but still we have to take care. What about gingival barrier in office bleach necessary? It's very important, Dr. Neeraj. I told you that if you use a rubber dam with inversion technique, you can directly do a bleaching. Okay, no worries at all. For example, if you are not using a rubber dam, you have to put a gingival barrier. It's very important, and also some protection on the lip. You can apply Vaseline on gingiva or lip, and then put a gingival barrier. Very important, and then do the bleaching. Okay. And if accidentally some bleaching agent goes to the gingival lips, I told you vitamin E oil is a solution which you can apply so that the post-operative symptoms and the bleaching action on the gums and the lips is minimized. Okay, so we have to put a gingival barrier. It's very important. Sodium perborate available in solution or gel solution. It's available in solution. We have to make a paste. ठीक है, it's a ठीक है, we have to make a paste. So if you ask for your normal dealer, he'll give you sodium perborate that you can mix. You have to make a paste consistency basically, mix with saline, LA, anything, with any sterile water basically, and then you have to apply on the tooth. So after the paste is made, the same thing which I told you, they have mentioned at least for 1 to 2 weeks and then restore. Okay. Now it's a modified. Now the technique which I explained you just now was walking bleach or intracoronal bleaching. Now we are into the non-vital bleach, which is a modified version of walking bleach, or known as inside outside bleaching or modified walking bleach. Now the case is the same, the indication is almost the same, the technique is a little different. That in this technique basically we'll follow the same instructions, that is we'll seal the orifice with 2 to 3 millimeters of GIC, and followed by, in normal walking bleach we used to place a paste of sodium perborate. Now we will not use sodium perborate, we will do a home bleach. Basically we will do a home bleach in which the solution we'll keep the coronal part of the chamber open. That is, we'll just put a cotton pellet. So we just seal the orifice, we leave the chamber open, putting just a cotton pellet, and we make bleaching trays. And the patient, when he weighs the bleaching tray, the solution is directed into the chamber, both externally with the help of bleaching tray and also as the chamber is open. So it's both external and internal bleaching basically. So this is a modified bleaching technique in which we use, let's say, home bleaching technique with the open chamber. But remember, the orifice has to be sealed, and we put a cotton pellet to prevent any food getting dislodged into the chamber. So the gel solution in the bleaching tray will contact the label surface also and the internal surface also. Okay, this you can do in office also. Some people do in office bleaching with hydrogen peroxide in this cases. But very important, guys, if the barrier is not strong, the chances are there that you can have cervical resorption. So these are the techniques. So we have to observe after a week. Yeah. So in this What add-on you have to do? You have to tell the patient to come after a week. Okay, you have to assess the shade after a week, and as the desired shade is achieved after 2 weeks, you can do a composite restoration. Okay, so I think this was okay. It was just a modified technique. Now, yeah, before start giving an example of laser bleaching, I would like to add upon, yeah, this zoom lights bleaching is also there. It is also very similar. The zoom light bleaching, in which we apply the bleaching agent on the tooth, and this light is placed. It has a wavelength of around 400 to 500 nanometers, and we place the light for 10 to 15 minutes depending upon the manufacturer instructions, and then we wash off the solution. Now it is basically, few studies have shown that when we use this, the results achieved are faster. Okay, the study which was done exclusively with zoom light, okay, Philips zoom light, but I told you the recent studies have shown that not much difference. Okay, it's basically a controversial whether useful or not, but if you have, well and good. If you don't have, you can just do a normal bleaching procedure as I have mentioned. Okay, now the as lasers have been started coming into a routine practice, so one more mode is there in laser light, the especially the diode lasers, soft tissue lasers. We have an extra mode in which we can do tooth whitening. So I just want to remove one myth, because many of the patients and many of the doctors, also those who haven't used laser, they think that laser is doing a tooth whitening, guys. So it is not a laser bleaching; it's a laser assisted bleaching. इसका मतलब कि जो आप ब्लीचिंग एजेंट लगाओगे, जो सॉल्यूशन लगाओगे, वही काम करेगा, लेजर सिर्फ एक्ट करेगा. Rather than the other light sources, we are using laser as a light source. That's it. The funda and the advantage or the benefit is the same, that the bleaching agent, the hydrogen peroxide which you have applied on the tooth, will oxidize or will dissociate faster to produce nascent oxygen and other superoxide or per hydroxyl ions, and the action would be faster. So it is just an assisted, laser is assisting the bleaching agent. Okay, it is not doing bleaching itself. So very important. So as mentioned in the literature, we use H2O2 35%, and different lasers used are argon, CO2, other gallium and all. But routinely which we use, we have soft tissue lasers ranging from the wavelength of 810 to 900, yeah, I guess. And we have a light source and we can achieve good results. Okay. So yeah, with lasers the results are good, fine, but as through several articles have shown that the results can be achieved, similar results can be achieved with reduced post-operative sensitivity without the light source also. One thing I believe, yeah, if you use a light source, the results would be faster. So chances are there, if you use a laser assisted bleaching or a zoom light bleaching or other light source bleaching, the results would be faster. For example, if you may have to do 2-3 times the same procedure replacing the solution, yeah, with these lights and all, the chances that the results are very fastly achieved in the same sitting. That is, I think, more advantageous, what I feel. Yeah, one more technique which I want to discuss is micro abrasion, which I don't see a lot of people practicing, but it has few indications in specific cases where the normal bleaching procedure won't be effective or will result in the results won't be good. So you can apply this micro abrasion technique. Okay, so it is just a use of a strong acid, that is HCl, hydrochloric acid 18% यूज करते हैं स्पेसिफिक एरियाज पे. ओके, तो वो क्या करेगा, वेरी थिन लेयर ऑफ इनामल को इरोड कर देगा और एब्रेड कर देगा. तो द लेयर विच हैज बीन ऑन द सुपरफिशियल लेयर can be abraded or eroded, and also I'll say specifically कुछ white spots पे या yellow stains पे जो superficially present होते हैं, people go for microabrasion. Okay. So indication developmental intrinsic stains, enamel discoloration with hypomineralization and hypermineralization. Okay, so we can have yellow spots in hypomineralization and white spots in hypermineralization on enamel. These are the good indications. Decalcifying lesions. Okay, yeah, due to the plaque and ortho bonds, ortho bands, basically banding. I'll say brackets specifically. They can be decalcification and some staining would have cast up. In such cases, to remove that superficial layer of the enamel, we can do microabrasion, enamel fluorosis, or multicolored superficial stains with some irregular texture. So I'll say microabrasion is specifically indication on the superficial enamel surface, in which our main motto is to remove the superficial enamel layer and leave an intact inner enamel to achieve I'll say brighter results within a setting. So, contraindication I won't discuss. The technique is simple. You have to apply the microabrasion agent, that is 18% HCl, on the tooth for at least 60 seconds, and then you have to rinse. And if you achieve the results in first go or second or third go, you can stop it and you can repeat the procedure till you achieve the desired result. तो 60 seconds में इसलिए वॉश करने का है because the acid is strong and we don't want extra abrasion or extra removal of the superficial layer of the enamel. So it's very important to wash off regularly. And very important, I tell you, when you do a bleaching protocol with any of the technique, you need to rinse the tooth with water copiously because tooth dehydrate भी हो जाता है बहुत सारा, ठीक है? And followed by that, you can put a sodium fluoride or APF solution on the tooth, which will help in reducing the sensitivity. So they have told the same. Apply a topical fluoride for at least 4 minutes. I'll say 8 minutes is good enough. And then you can follow up the visits according to the desired change. So this is a beautiful example in which you can see there is hypermineralization or fluorosis, fluoride stain, or hypermineralized enamel, whatever it is. You can just apply the solution and then you can achieve the results. Okay. So I'll say in this type of cases where we just need to remove superficially, because I told you in such type of cases if you do go for a complete bleaching, तो ये जो white color है ना वो enhance हो जाएगा, ये white opaque color would be more prominent. So these are the cases to go with microabrasion. You just apply the solution in this area, there it will remove the superficial enamel, and then you can go for just a desensitizing agent. That's it. तो ये सिंपल सा फंडा है आपका माइक्रो एब्रेजन का. तो गाइज आई थिंक few basics are cleared regarding the chemistry or the science behind bleaching. What are the common I'll say bleaching agents used and the other components of bleaching agent which help the bleaching agents, different light sources which we can use, starting from a normal I'll say a tungsten halogen to a Philips zoom light. You know, the only advantage is that you may achieve faster results, that's it, but the results would be similar. Okay, the results would be similar. Most of the studies have shown. Now you know ki if you don't have a light source also, then also you can get a good results. And we spoke about, I'll say, laser assisted, which just assists, that's it. It doesn't do bleaching, it just assists the bleaching solution by putting the laser light. The action would be faster. And lastly, we discussed about the microabrasion technique, which is commonly indicated on the superficial enamel stains, which may be yellow or white depending upon the condition, and where it removes the superficial layer with this acid, and we can achieve good results. So guys, if you have any doubt, you can ask me. So this was my brief session on tooth whitening, in which I was more focused on explaining you chemistry and the different techniques and the recent studies which have compared different techniques of bleaching to achieve desired results, and what are the things which you can apply clinically with having this basic knowledge, and select the necessary patients which are a pure indication to go for bleaching. Okay, I won't say every patient is a good indicator or a good indication. You have to select. Now, at least by this basic session, you are aware which patient to select, which case, which technique you can follow. So, guys, great results can be achieved if cautiously done in a right candidate. I always say selection of the patient is very important. Okay, and best patient is who is self convinced. Okay, but you have to remember he shouldn't be hypersensitive, and the staining shouldn't be very strong, or I'll say the staining shouldn't be a pitted in which that dentine is exposed, or where the patients have high or I'll say high pulp horns or large pulp chambers. So, guys, I think it is fine. You guys are not asking questions these days, but still in the comment box you can mention later also. Ending this session with a bright smile, and keep smiling, guys. And ending this session and the month of May with the tooth whitening session sharing, and hope the next month goes great. You are more equipped with a lot of new equipments and practice in specific cases with following all the precautions, and hope I also keep on taking sessions, or I may take a break for a month for the sessions. That will decide next week. And if you want specific topics to be discussed, you can just mention in the comment box or mention in the virtual clinical dentistry page. And these sessions will be uploaded in my YouTube channel, Dr. Nitin Shishodia, which you can see later also. So, guys, take care. Enjoy last hour of the month. And from the June, we'll just do good, strong sessions and practice in our clinical practice by taking all the precautions. Till then, bye bye. Take care. Thank you for being such a nice audience listening to the sessions. Take care, guys. Have a great night. Bye bye.